Ma'am,
So good afternoon, everyone. This is Dr. Gayatri here. I am a fertility consultant practicing at Oasis Fertility at Bhubaneswar. Today, we are going to discuss on the various lifestyle factors that affect fertility. So there are various lifestyle factors which can either improve our fertility outcomes or even they can decline our fertility outcomes. So knowing the lifestyle factors in details is important because sometimes even with these subtle lifestyle factor changes, a couple is able to achieve fertility easily. And also for those couples who are actually undergoing any kind of treatment like any IUI or IVF, simple lifestyle measures can even enhance the success rate of these fertility treatments. So the lifestyle factors are important to know because these lifestyle factors are necessary for enhancement of overall well-being and also because they are under someone's control. So and they play a key role in not only determining how the overall health and well-being of the couple is, but also they help in determining the reproductive health of the couples. So here I'm listing to you the various lifestyle factors, and actually the list is quite big than what is being displayed. So some of the important ones are like the radiation which is being released from the mobile phones, then the environmental pollution, then exposure to chemicals and pesticide, use of illicit and pharmaceutical drugs, then use of smoking and drinking, and disturb circadian rhythm, then stress, then eating disorders, obesity, and improper eating habits and nutritional insufficiency, socioeconomic factors, and also sexually transmitted infections and sexual violence. So, if we normalize some of these modifiable risk factors, which can have an impact on fertility, it can help in and benefit both men and women. In women, it can help in improving the oocyte maturation, improving the implantation rates, improving the pregnancy rates, improving the overall pregnancy outcomes. And in males, it can help greatly in improving the semen quality. So the age of the couple is the first important risk factor, although not completely modifiable because once a couple has come to us at any particular age, we cannot go back in time. But it's important to know that we do not delay parenthood a lot because right now what is happening is because of the present the pursuit of education and other factors, women are more career oriented. So the couples are generally having a tendency to delay childbearing. So it's important for all couples to know that fertility peaks at a certain age, but then after a certain time it decreases also, and this is applicable to both men and women. As you can see in this particular graph, as a woman's age advances, particularly after the age of 35, the fertility decreases tremendously, as well as even if those women who conceive, there is an increase in the rate of spontaneous abortions. Not only this, there is an also increase in the risk of genetic syndromes, for example, Down syndrome in a woman who conceive after the age of 35 or 40 years. Similarly, there is also an effect of paternal age on the fertility outcomes. So, for a male person, generally the impact is seen after the age of 40 years. So, after 40, there is a slight decrease in the semen quality, the parameters, the sperm DNA fragmentation increases, and there is a slight decrease in the fertility levels. But also, the effect of paternal age is not only on the sperm quality, but also we have seen that an adverse reproductive outcome is seen when sperms are taken from men who are of advanced age, particularly those men who are more than 40 years. So, what we have seen is there are chances of lower success with assisted pregnancy treatment, and then there can be pregnancy losses, there can be premature birth, stillbirth, and another alarming thing which is also being noticed is that these offspring may have subtle neurodevelopmental disorders in the later part of their life. For example, these children may sometimes have autism or may have schizophrenia or other bipolar disorders. So, neurodevelopmental disorders is something concerning. So, this is why even males should not try to defer parenthood a lot. So the next important lifestyle disorder, again very commonly seen among females, especially who are in all the urban cities and urban metro cities, is the eating disorders. So this is basically because they are all women have this image of a perfect body shape, and to achieve that they are either strictly starving themselves or they are inducing vomiting. So the most common disorders are bulimia nervosa, where a woman tries to eat a lot, which is called as binge eating, but after that she either tries to go for a severe fasting or she tries to induce vomiting. And the second is anorexia nervosa, where there is an extreme form of self starvation. Again, that is basically to achieve that particular body image. But then with these eating disorders, it suppresses ovulation and it is difficult for a woman to conceive. The third important modifiable lifestyle factor is diet. Diet has got a tremendous role to play on the fertility outcome. So, whenever a couple is coming to us for the fertility treatment, we always give them a good advice on what diet they should follow and what they should not follow. Because a diet which is rich in minerals, vitamins, antioxidants also can boost up your fertility. So basically, a good fertility diet means that it should have a good amount of good quality carbohydrates. So good carbohydrate means which release sugar slowly into the blood. So these are the whole grains. So you can include brown rice, you can include millets, quinoa, etc., and also the green leafy vegetables. You need to eliminate trans fats and include more of unsaturated fatty acids. Omega 3 fatty acids can be obtained from fish sources. Try to include more of plant proteins and then being dependent on animal proteins. And you need to take a multivitamin also supplement along with the good diet which you are taking. Particularly here, I would like to emphasize on folic acid because it's recommended that a woman who is planning to conceive should at least take 400 micrograms of folic acid 3 months prior to her conception. And also you need to completely cut down on the sugar sweetened beverages and the water, and you should go for a glass of milk. So drink 6 to 8 glasses of water. You can choose full fat milk over low fat milk, and you need to avoid sugar sweetened beverages. Whole grain meals has to be taken. Low GI index carbohydrates need to be preferred. So cut down on the white rice, cut down on the potatoes and other starchy food items, and eat a lot of green leafy vegetables and proteins. Also, you should try to have more of plant-based proteins. Limit the meat because these meat and products generally they are all inflammatory foods. So sometimes they can flare up the other body conditions. For example, they may flare up endometriosis inside you, and fats, go for healthy fats. You can go for unsaturated fatty acids, for example, which is present in olive oil. You can go for coconut oil, but avoid trans fat, deeply fried foods, and packaged foods. So the foods which need to be avoided while you're planning to conceive, and also if you have conceived during pregnancy, also you should try to avoid these. These are the ultra processed foods, the trans fats, highly processed oils, all kinds of packaged food items because they contain a lot of additives and preservatives and artificial colors and high fructose corn syrup and refined grains such as white flour. So the next time when you're taking any product over the shelf of a grocery mall, so please read the label of what is the ingredient present within the item, and then accordingly you can either buy or you can omit buying that product. The second important factor which you need to consider when you're planning to conceive is that you achieve an ideal body weight or a BMI. So, an individual's weight is based upon the diet the person is taking and also the amount of activity the person is doing. So, body weight is having an impact not only on our infertility but also it can have an impact on the overall health of the person. Particularly, the cardiovascular disease is on the rise nowadays because of the rise in the body weight. So it is important that a couple should have an ideal BMI, which is 18.5 to 24.9. You have a lot of BMI calculators available online where you can put in your height and weight and then check yourself which BMI you fall in. Even underweight is not good, and overweight and obese, extremely obese BMI we have to avoid. So you have to have this normal range BMI. And so this normal range BMI for especially for a female is not only important because she is planning to conceive. It is also important because if a woman is obese pre-pregnancy, then in her pregnancy she can land up in a lot of problems. For example, during pregnancy, such woman have increased chances of developing diabetes. They have an increased chances of having blood pressure rise during the pregnancy. So all that can have an impact on the baby also. The baby may sometimes land up in stillbirth. There can be sometimes metabolic problems, developmental abnormalities in the baby. And in the long term also, it has been seen that mothers who are obese, those children have a future risk of having obesity, diabetes, and blood pressure when they are adults. Next important lifestyle factor is to concentrate on exercise. It's important to know that a vigorous exercise is again not recommended because a very severe exercise can again prevent ovulation in females. So, as doctors, we advise for moderate exercise, which includes 30 to 40 minutes of brisk walking. You can also go for strength training or yoga or pilates or swimming, which induces some form of sweating inside your body. And this is form of exercise you can do 4 to 5 times, 4 to 5 days in a week. And apart from this, yoga postures help a lot in improving the fertility outcome because they improve the blood supply to the pelvis and to your ovaries. And so there are particularly some good yoga postures which you can include in your daily fitness regime. For example, the cobbler's pose, the cobra pose, lotus pose, supported bridge pose, and legs up the wall pose. So practice these, and definitely you may have a lot of benefit in not only losing weight but also in improving your pregnancy outcomes. So, with regard to exercise, very important to understand: do not overdo it. And standard 30 minutes of moderate exercise is what is required to achieve a good fertility outcome. The other important lifestyle risk factor, again very commonly seen among both men and women, is smoking. Remember, smoking has a detrimental impact on fertility among both men and women. So in men, there can be problems with the semen quality. There can be decrease in the count, motility. Also, the sperm DNA gets affected. So there is an increase in the DNA fragmentation. And also, these men who smoke, they also tend to have some kind of sexual dysfunction. Among females, what we have seen, those who smoke, they tend to lose the eggs faster from their ovaries. So they come to a decreased ovarian reserve. Secondly, the egg quality is also gets affected, and there are other problems like anovulation, premature menopause, and these women also tend to have an increased risk of miscarriage. Remember, it is not only the active smoking which is not good for you, but also passive smoking. That is, women do not smoke, but if their partners are smoking and they are exposed to the smoke at their house, so then that is again detrimental for them. Again, another important lifestyle risk factor is the effect of alcohol, which we need to understand. So, alcohol consumption is a strict no-no. In males, it has been seen it can cause decrease the testosterone production. Testosterone is a main male sex hormone. It decreases sperm maturation. There is testicular damage. There can be sexual dysfunctions like erectile dysfunction, and increases stress. In females, there can be menstrual irregularities and also oocyte maturation defects. And not only this, during pregnancy, in case there is any kind of alcohol intake, there is a severe growth abnormalities in the baby. And alcohol is strictly a no for those women who are planning to conceive. The next important, very commonly asked question is whether doctor can we have coffee when we are planning to conceive. See, moderate caffeine consumption is okay. So up to 2 or maximum 3 cups of coffee in a day is fine. But more than that, caffeine is not advised. And some studies have suggested that caffeine in females can cause some kind of obstruction within the fallopian tube so that the egg and sperm are not able to meet. So we advise females to limit the caffeine intake. So up to 300 milligrams of caffeine is what is allowed when somebody is trying to conceive. Now coming to males, there is no conclusive any evidence whether caffeine has got any role. So right now for males there is no such inhibition whether they should not drink or drink. And again, a very important risk factor which something is concerning, alarming, is the regarding the radiation which is exposed from the cellular phone, particularly in males. Why? Because males tend to keep the mobile phones in their pockets, which is very close to the genital area, and the radiation which is released from these mobile phones has an effect directly on the testis. Testis has various cells, the Leydig cell, it has got tubules, it has sperm, so all these get affected, and thereby the sperm count is decreased, motility has been decreased, and sperm viability, morphology has all shown to be decreased. And studies have shown that even in case of females, there may be an increased risk of miscarriage because of this magnetic field exposure. So here are some of my tips for so how you can prevent the damage. One is that you can, instead of talking, you can opt more for texting. And also when you're texting, you try to keep the phone slightly away from you. Second is, if in case you are on call, you try to keep it as short as possible and try to use a corded phone, and try to make calls in high coverage networks, because when you are in a low coverage network, your phone tends to emit more radiation at that particular time. Now, the again a very important risk factor, which is something which is very difficult to take out completely, is the stress, which has become a part of our lives nowadays in both males and females. Now, so stress, anxiety, depression, these all have a tremendous impact on the fertility outcome. It has got a tremendous impact on the treatment outcomes also. So, in case of male, stress has been shown to decrease the sperm quality, quantity, decreases semen volume, decreases libido, and it causes erectile dysfunction. In case of female, a stress can cause amenorrhea, that is, they stop getting their periods, anovulation, that is, there is no ovulation, so there were no ovulation, no proper periods, so no pregnancy. Again, in similar to males, even in females, stress can cause a decrease in the libido and decrease implantation and pregnancy rates. So here are some of the relaxation tips that you can follow. One is follow your hobbies and muscle relaxation, for which you can even go for acupuncture, you can go for music therapy, yoga, and you socialize with like minded people. And definitely stay away from those people which build up stress within you. And deep breathing exercises, yoga, meditation, they all help. And proper rest is very essential. 7 to 8 hours of good sleep is required, and you can stay busy throughout the day and keep your mind in your work or in your hobby, so that you stop overthinking and multiplying negative thoughts in your mind. So these are some of the various factors which affect fertility in one way or the other. I have tried to cover some. There are a lot more. So if the basic idea here was to tell that if we take care of at least some of these lifestyle factors, particularly the diet, exercise, good sleep, and take care of our stress, it can help us a lot in achieving a good fertility outcome and a good pregnancy outcome in a short duration as much as possible. Thank you so much, and I would be happy to answer if there are any questions by the audience. Thank you. So the first question is, can lifestyle changes improve fertility? Yes, lifestyle changes can improve our fertility. So just because a couple has come to us and has started a treatment, that is not the only treatment. Most of the time, lifestyle modification is the first line of treatment, and next comes our treatment. So lifestyle modification, most important is to take care of a good diet, which is loaded with fruits, vegetables, and healthy diet. Healthy, balanced food is required. Taking good sleep, rest, and taking care of what you're taking in, and saying no to caffeine, saying no to saying no to alcohol and smoking is absolutely required, and reducing mental stress. So all these small lifestyle changes can have a big impact on your fertility outcomes. Can stress cause infertility? Yes, so stress is building up a lot. So stress is there at the workplace. For females, the stress is there at home. And then there is an additional stress that a couple is not able to conceive. And then when somebody is coming for a treatment, then again that adds up to the stress. So we understand that there is a lot of stress which is associated with infertility. But if you try to reduce the stress, which is again in your hands completely. So there are a lot of techniques, as I mentioned. You can go for yoga, you can go for deep breathing exercises, and try to keep yourself engaged. If you try to reduce the stress, there's a lot of positive environment which gets built up inside your body, which helps you in achieving a good pregnancy outcome. How do I know if my husband is infertile? So the first important thing is to let us know if there is any sexual dysfunction from the male partner. So that needs to be evaluated. And the second important thing is, if there is no sexual dysfunction, then the simplest way to know the fertility status of your husband is through detailed semen analysis, whereby we see both the count, the movement, the morphology, and other semen parameters, and let you know if there is any problem in the semen. So generally, this is if This is the one and the only investigation which is most of the times offered to the male partner to know if the male partner is fertile or infertile. So how can I stop fertility problems? So fertility problems is, see, initially if you have been married for a year and you're not able to conceive, so then you need to come to visit a fertility specialist. And or if you are more than 35 years, or if you have irregular periods, or if you have had any history of any particular gynecological disorder, for example, if you had history of any fibroid or endometriosis, so and you have tried for 6 months, you're not able to conceive. So get evaluated by a fertility specialist because it is important to know where exactly the problem is, whether the problem is with the male partner or with the female partner. So once the diagnosis is made, we make a plan, and simultaneously the other lifestyle changes, as I mentioned. So together that can help you in solving your fertility issues. So, can infertility be cured? Again, infertility has a lot of reasons. So, most of the reasons nowadays are curable. With curable, what I mean to say is, for most of the infertility problems right now, we have solution. We have solution like simple ovulation induction and timing of your intercourse, and two solutions like IUI, which is again a very simple treatment. And we also have solutions, advanced solutions like IVF and ICSI, whereby at least 80 to 90% of the couples are able to achieve pregnancy through their own eggs and sperms. Yes, but there can be few couples who cannot be completely cured of their infertility problems. But yes, majority of the couples are able to now enjoy the benefits of the advanced fertility treatment options, which are available at most of the fertility centers nowadays. Yeah, so thank you so much. I think we have answered most of our questions. Any further questions are there, please write down in the comment section and we'll be happy to answer you. Thank you.